Ascariasis is an intestinal infection caused by the parasitic roundworm Ascaris lumbricoides. It is one of the most common human helminthic infections worldwide, affecting an estimated 1.5 billion people, particularly in areas with poor sanitation and hygiene. Today, we will explore all aspects of this infection, including its life cycle, symptoms, diagnosis, treatment, and prevention. Ascaris lumbricoides is a large nematode, reaching lengths of up to 35 centimeters in adults. These worms primarily reside in the small intestine of their host. The infection starts when a person ingests Ascaris eggs that are present in contaminated food, water, or soil. This is often associated with improper sanitation practices, such as the handling of feces or consumption of unwashed vegetables grown in contaminated soil. Once ingested, the eggs hatch in the small intestine, releasing larvae that penetrate the intestinal wall and enter the bloodstream. From there, the larvae migrate to the lungs, where they mature further. After a brief period in the lungs, they ascend into the throat, where they can be swallowed back down into the gastrointestinal tract. This entire life cycle takes about 2 to 3 months. Once back in the intestines, the larvae develop into adult worms, which can live for 1 to 2 years. As for symptoms, many individuals infected with Ascaris lumbricoides may experience no noticeable symptoms, especially in mild cases. However, heavier infections can lead to a range of symptoms, including abdominal discomfort, malnutrition, diarrhea, and even intestinal obstruction in severe cases. In children, who are particularly vulnerable, ascariasis can result in stunted growth and reduced cognitive development due to nutrient malabsorption. Diagnosing ascariasis typically involves examining stool samples under a microscope to detect Ascaris eggs. If present, it confirms the infection. In some cases, imaging studies such as X-rays or ultrasounds may be used to identify adult worms or obstructions in the intestines. Treatment for ascariasis is straightforward and generally effective. The primary medications used are anthelminthics, such as albendazole or mebendazole. These medications work by disrupting the metabolism of the worms, which ultimately leads to their death. Most individuals experience significant symptom relief after a course of treatment, and a follow-up stool examination is often performed to ensure that the infection has been cleared. Preventing ascariasis largely revolves around improving sanitation and hygiene practices. Wearing shoes in areas where soil may be contaminated, washing hands with soap and water before eating or handling food, and ensuring that food is properly washed and cooked can greatly reduce the risk of infection. Community health initiatives that promote sanitation, especially in rural and underdeveloped areas, also play a pivotal role in controlling the spread of this parasitic infection. In conclusion, ascariasis is a common yet preventable infection caused by the roundworm Ascaris lumbricoides. Awareness of its transmission, symptoms, and treatment options can help mitigate its impact, particularly in vulnerable populations. By promoting better hygiene and sanitation practices, we can significantly reduce the prevalence of this intestinal infection and improve overall public health. Thank you for watching, and if you found this video informative, please consider subscribing for more educational content on health and disease.